Dr. Nazari, let's talk a little bit about root canals. I have lately heard that when you do a root canal, you're really not taking out the root. I was always under the impression, I think so are most people I know, that when you do a root canal, you take out the root. But apparently that's just not the case. Can you explain a little bit a root canal, where it comes from? And then mainly, can you actually tell us that a root canal isn't quite anymore as drastic as we apparently think it is? After all, we make all kinds of jokes, even like paying taxes. It's like having a root canal, and everything is measured by how bad it is towards a root canal. But the last one I had, which was 4 or 6 years ago, I don't remember, more than that actually, I think, frankly, rather than having the mouth open a little bit, which became a little boring and a tiny bit awkward, but rather than that, there was no pain. I wouldn't have known what the heck he's doing in there. So tell us about it.
Well, that's what I taught before I went to dental school. And after I went to dental school, I learned what the root canal is. That's what I thought. They're going to take off the root of the tooth. Basically, root canals are not as painful as paying taxes at all. Taxes are much more painful. Root canals are designed, and these are techniques that to provide dentistry for patients, so they will not be losing their teeth. If the tooth becomes symptomatic, meaning having throbbing or severe sharp pain, or there is a decay or cavity which has invaded into the nerve of the tooth, that we call it pulp, we try to save the tooth by doing a root canal. Root canal basically is we go inside the roots of the tooth. Every tooth that you look at of the tooth, there are nerve inside the tooth. That's what we can feel the pain on the teeth. That provides us a sensory mechanism that that would protect our teeth from biting into hard things, so they will not be breaking and hurting us. So the dentist, with special instruments, they go and they remove the nerve from inside the roots. That's what they call it, the root canal. Go and then removes those, so the patient does not have any more sensation on those teeth. And immediately after that is done, you need to cover the teeth with a crown or a full coverage prosthetic to protect the tooth from chipping and cracking or breaking. If the tooth loses its sensory mechanism in order to protect itself.
I see. So I've heard that the tooth, once you have done a root canal, it basically the nutrition channels, the nerves to the tooth are missing, and thus the tooth becomes more brittle. It becomes more able to fall apart by its own. Never mind that also you did drill a hole in it, which makes a full substance of a tooth, kind of like a pipe, and so there also it can break, and that's why it needs the crown over. So is it true about the nutrition, not coming to the tooth anymore so well after root canal? Is that a true statement?
Yes, absolutely. And then there is the circulation of the blood and the fluid inside the tooth, and the tooth becomes like a dry piece of wood, that it is more brittle than an actual branch of a tree. That it can break real easy. That's what we recommend, to place in a crown on it immediately.
But there are some people out there, they had a root canal and no crown for quite a while. Were they just lucky?
Well, that's part of it. There's luck, and also their chewing habit and the type of food that they eat. And also many of the front teeth, we don't recommend to get in a crown on the front teeth. So that can be either the front teeth that did not have a huge decay, that we can just put a filling in there, a proper filling, to cover that decay part, or in the back teeth, that depending on the patient's bite and their chewing habit, they can get away for a little while. But most of the patients eventually, sooner or later, they end up losing those uncovered teeth.
All right. got to do what you got to do, I guess, huh?
Yes.
All right. Thanks a lot, Dr. Nazari.
Thank you, sir.